with our colleague from Tunisia. Madame Mezraoui is going to present the experience of the Ministry of Social Affairs in Tunisia in designing and advocating for really transformative universal child cash grant programs. She's very much a champion of this program. She participated in the main discussions from its very inception, from its start, and she is now leading a very important institutional innovation in Tunisia, the intra-agency, intra-ministerial working group committee that is trying to put in motion the policy process that will make this grant implemented, a reality. So after this presentation on one country, we are going to move to the presentation from our friends and colleagues from the International Poverty Center in Brazil, who did a very interesting review of the experience of the entire region, looking mostly at the universe of child grants, the way how they are present in Middle East and North Africa countries, and looking at their how the human rights perspectives and the legal framework is organized around those grants. And finally, we are going to hear from Atif, who is representing UNICEF, a very interesting case of Iraq, how Iraq is approaching a very complex issue of child poverty and what it's doing and what is the reflection now in the country. So without further ado, let me welcome Maha to give us her overview of the child grant program in Tunisia. The presentation is in French. The slides are also in French, but we are getting a parallel translation, so those of you who are not following French, please make sure you have your microphone.
Monsieur le Président, donc, chers collègues, donc, je vous remercie de me donner cette occasion de présenter un peu le travail en train d'être mené par le ministère des Affaires sociales tunisien. On est encore, comme M. Ruslan l'a bien souligné, dans une phase de conception, de discussion, une large discussion avec nos partenaires sur ce nouveau programme qu'on veut mettre en place, à savoir l'éducation universelle pour les enfants. Donc, mais permettez-moi tout d'abord de présenter, je ne sais pas comment ça marche ça. Next. Ah. D'accord. Donc, quand même, je vais vous décrire un peu dans quel cadre se situe cette réflexion sur une protection sociale en faveur de l'enfance. Comme vous savez, depuis 2011, nous sommes engagés dans un vaste chantier de réforme de différents programmes en relation avec la protection sociale d'une façon générale. Donc, le document le premier document qui énonce cette réforme, c'est le contrat social qui a été signé entre les partenaires sociaux et le gouvernement tunisien le 14 janvier en 2013 et qui trace les grandes lignes pour un nouveau modèle sociétal et économique pour le pays et qui énonce clairement, qui stipule clairement que les grandes lignes d'une réforme globale de la protection sociale en Tunisie doivent être faites. Cette orientation a été reprise dans le premier plan de développement quinquennal de la Tunisie 2016-2020, donc le premier après la Révolution, qui a inscrit la réforme de la protection sociale comme une des réformes majeures et qui devrait à terme...
One of our national priorities, it should lead to setting up a national social protection floor in line with the ILO's recommendation 202. To further underscore this work, we have a Decent Country Working Program signed in 2017. This again takes up this national priority. Article 47 of our new constitution, the 2014 constitution, refers to children, and it says that dignity, health, healthcare, education, and training are guaranteed rights for children, guaranteed by their parents and by the state. The state shall ensure that children have access to all forms of protection without discrimination in line with their higher interests. We also have the SDGs. Tunisia is committed to the 2030 agenda, and recently we have also aligned ourselves with the World Bank's new initiative on human capital. The global status for children in Tunisia, we've made quite significant progress on the social front. Our statistics vis-à-vis children, however, do show some shortcomings. Children represent approximately 28% of the population of Tunisia, and nevertheless, poverty rates are rather high, 25% for children, so that's 10 points higher than the national average. 1 of 2 children lacks at least one of their fundamental rights. We saw this coming out of a study, the NMODA study, which considered how children were not having access to these rights. And this was a 2015 study. In terms of schooling, 16% of children under the age of 16 do not have access to basic education services in certain regions, especially in the most underprivileged regions. We can even see poverty rates hitting 47.7% for children in certain regions. So that means that our programs aren't quite as effective as they could be, especially when it comes to targeting children. As I said, progress has been made. If we look at the population of children between the age of 0 and 18%, we have approximately 3.1 million children. We have 2 systems for them, a contributory system, the social security system that is, which covers 1.19 million children. They receive family benefits. Even in this system, however, there are some areas which are not applying the same policy. So only 3 regions have these child benefits. There's also a restriction of 3 children. Beyond 3 children, there are no family benefits for additional children. Now, these are quite old programs. They've been in place since 1988, and so there may be a need for an overhaul. Now, for the non-contributory system, we have one program, just one program, which provides cash transfers to children starting at the age of 6 for children in school. But this is a rather low percentage of children, a rather low sum of money as well. There's a larger cash transfer program which encompasses their families, especially for older people. So it doesn't really represent too many children, just 15,000, a very low number. There's also a cap of 3 children there. And children between the ages of 0 and 5 are excluded from this program. So if we look at these 2 programs, we can see that there's quite a few children that are not covered, 59.3%, who are not receiving cash transfers of any kind. The same can be seen in this graphic, which breaks things down by ages. So you can see that the age bracket of 6 to 12 is a little bit higher than the age bracket of 0 to 5. Cash transfers have been discussed at length over the last 2 days. Children are more vulnerable to shocks, and so not receiving a cash transfer can have an impact for children all throughout their life cycle. Nevertheless, I won't speak at length about this since this has already been discussed extensively over the last 2 days. As the chair said at the beginning, a pilot project was set up. We think that this doesn't fall only to the Ministry of Social Affairs, indeed child crash grants for all children. If they're not developed, well then they won't be effective. So we really are touching on various ministries, healthcare, finance, presidency, and many other ministries, women's affairs, employment. We had a policy note which covered all of this and laid down some proposals, namely having the ATE, the Tunisian Child Benefit, which might provide some harmonization to a very fragmented system and sort of clean things up. So this is our child benefit in Tunisia. We try to achieve 3 goals: universality. As we heard earlier, this is a process. You can't just go straight for trying to target everyone. We also need to review these sums. We had a study on cash transfers, non-contributory cash transfers that is, to see the impact on children's education. But the sum was so low that you really couldn't see an impact of this. So if we're going to be providing funds, we need to provide enough funds to have a real impact on child welfare. As I said earlier, the system needs to be progressive. So we've suggested 3 scenarios for implementation. One would be targeting the non-contributory system. The advantage of this is that the Ministry of Social Affairs is setting up a database on poor families or families with low income. This affects approximately 30% of the population, which is quite a sizable percentage of the population. It would also encompass many children who are not currently in the system, so we could capitalize on this database to set up this system. Another proposal would be to use age brackets, 0 to 5, and then progressively we'd roll this out and reach other age brackets. The earlier you start, the better it is. That's the advantage of this program. It's also worth noting that this particular age bracket is not currently covered, as I said earlier. So we have a national strategy for early childhood, which was just adopted, and this could really be a great complement to this program. We could reach preschool children, children in early childhood ages in regions that are not often reached. And that's why the Ministry of Health is currently looking at this, ways that we could really build upon this to reach this particular age group. The third option is geographic targeting. That was our first idea, but we're probably going to discard it because it really doesn't work that well for our country. It might also lead to some kinds of social tensions or unrest. It was a possibility, but it's one that we'll be sharing with decision makers. We want to give them various possibilities and let them decide. As for the sums, as we heard earlier, these need to be rather sizable. As we heard this morning in the presentation on Tunisia, we could start with the current system, but as I said, it's rather insignificant. If we look at both systems, the contributory and non-contributory systems, it's 6.7 dinars a month. The other option would be to not have a limit on the number of children and have 15.5 dinars per month, or to go to 31 dinars per month in the third possibility here. The third option. So these are back of the envelope calculations about the costs of this program. once it is rolled out progressively and is universal. If we look at the highest cost levels, we could hit 1.4% of GDP. That said, in light of the importance of funding, which we've discussed various times, we have just commissioned a financial analysis of the financial feasibility for this particular program. And I'd like to thank UNICEF for helping us with this, for providing technical support for this feasibility study. This allowed us to take stock of the costs and effectiveness of this program, and also to lay down a timeline for implementation. For each of the phases, we considered how we could mobilize funds, where exactly they might come from for each phase of the program. Now, I won't repeat what's been said over the course of the last 2 days, but we need to ensure that we offer high-quality services. There needs to be good coordination with the relevant ministries, and we need to reach out to parents to explain that these funds are for their children, for child welfare, so we need a good communication strategy so that people understand what this is about. We've said this over the course of the last 2 days, but we really need to raise awareness, not just amongst beneficiaries, but with all members of society, including civil society. Of course, we need to identify lasting funding sources. We need to think about the long term here. There are a few challenges which remain. Ensuring political support, we've heard this many times over the course of the last few days. We also need to have enough national funding to ensure that these programs are sustainable and long-lasting. We also need to bear in mind other reforms currently underway in the country. There are some imbalances for our social security funds, which currently represent a shortcoming for the country, especially when we're looking at the contributions. So we need to have good synergies amongst various programs and reforms currently underway to ensure that we move towards a single approach. We also need to have a national debate to identify priorities and consider starting with a progressive approach for reforms, and of course working with various guarantees on social protection. When we're doing so, there could be some overlaps amongst the various pillars of the social protection floors. Thank you very much for your attention.
Thank you for this comprehensive presentation and very concise too, really summarizing the main ideas, challenges, but also great promises that this policy proposal has. We now turn to the next presenters. Unless there are burning questions, I suggest that we collect our questions and then you have the chance to pose them at the end of the session. If there are any clarification questions or something burning, you are welcome. If not, keep your question till the end. And it's my pleasure to give a floor to Anna Karolina and Charlotte to present their study on MENA region. Thank you.
Well, good afternoon, everyone. Thank you for attending this session. Thank you, Ruslan, and thank you to the organizers also of this conference. My name is Charlotte, and I'm here together with my colleague Anna Karolina from the International Policy Center for Inclusive Growth in Brasilia. And we'll today be presenting the findings of our research on social protection, child-sensitive social protection in the MENA region from a child rights perspective. First, a few words on the research that we're presenting today. So we're basically presenting 2 studies that we developed over the course of the last 2 years together with UNICEF's regional office for the MENA region. Great. There they are. The first one was an inventory of all non-contributory social protection programs in the MENA region and their main design features, and this is the part that I'll be presenting a bit more. And then the second study is on the legal frameworks of the existing social protection programs in the region, and my colleague will present a bit more on those. So I will start with giving a brief overview of the social protection scenario in the MENA region, and we'll then look more specifically at the existing cash transfer programs in the region and their main design features. And then Anna Carolina will talk about the legal frameworks, and she will conclude our presentation. Not yet. Okay, first a few words on the context. Most of you are probably aware of the fact that the MENA region can be characterized by historically strong reliance on subsidies, food and fuel subsidies, as well as contributory social protection schemes. However, there is now growing evidence that both of them are limited in terms of reaching the poorest. And subsidies, and there's much evidence, including produced by our colleagues from the World Bank, are considered rather regressive. They tend to benefit the richest more than the poorest. And the contributory social protection schemes, on the other hand, often usually leave out informal workers as well as agricultural workers. Great. Another important issue to keep in mind for this presentation is that, unfortunately, the availability of data in the MENA region is quite limited. And often it is not known how many people are actually covered by the existing cash transfer programs in the region, which is also why I will in a bit present a bit on the estimations that we did in terms of coverage. And of course, it is not known, or even less known, how many children are actually covered by those programs. This, on the other hand, is of course important for SDG 1.3 and countries' obligations to report on the progress on SDG 1.3. And then the last point in terms of context is, as many of you probably know, that over recent years there have been quite some reform in the MENA region in terms of reducing subsidies and then sometimes using those revenues for more targeted cash transfer programs. Great. So now a bit on the existing cash transfers program that we mapped in this first study that I just showed you. We found that actually all countries in the MENA region have one or more cash transfer, non-contributory cash transfer program. Of 155 programs, we found that 74 were actually cash transfer programs, so either conditional or unconditional. And this is quite a high number when compared to in-kind transfers or public works programs. We also looked at who these cash transfer target, because there's a diversity in terms of size and also target groups. So we found that many cash transfer programs are actually for particularly vulnerable groups, such as people with disabilities or the elderly or widows. Of those 74 programs that we mapped, we thought that 35 are targeted at children or families with children. But half of those 35 are actually for orphans, which shows once more this traditional reliance on groups that are considered as particularly vulnerable in the societies. On the right in the graph, you can see the main targeting mechanisms used by the cash transfer programs in the region. And we can see that most of them use categorical targeting to precisely identify these vulnerable groups in combination with a means test. We see there are some programs, and this has become more common recently, that use proxy means test, such as, for example, the Takafo program in Egypt, but it's still less common in the region. Okay. Against the topic of this conference, it's of course, we asked ourselves, okay, so how far is the MENA region actually from universal child grants? This has been also discussed over the yesterday and today, that child grants are actually often affordable, and ILO colleagues have also produced studies on this for the MENA region. However, we see that there's, right now there's no universal child grant in the MENA region. There is in Libya, for example, in theory, a universal child grant, but it is not known to what extent this law is actually being implemented and how many children actually receive this, this cash transfer foreseen by law. There is, in Iran, we have a quasi-universal cash transfer. It's not specifically a child grant, but there are also attempts to actually make it more means-tested. And of course, we have some employment-related cash transfers in the MENA region. As I already mentioned, the contributory schemes are usually more consolidated than the non-contributory ones. But when we look at the non-contributory ones, we see, as I also already mentioned, that for many of them, it's actually not known how many households they cover or how many children they cover. So we saw that only about half of the programs that we mapped, there are figures available in terms of their coverage, which is also why in a bit I will present a bit on the, there we are already, on the estimations that we did. So in this graph, I'm not going to go into detail in terms of the methodology. Whoever's interested, I invite you to read the study. But basically, we tried to estimate how many children of the whole child population in those countries are covered by the cash transfer schemes. And we selected a few here. So in dark blue, you can see the percentage of the whole child population that could be covered by those. And in light blue is the share of those children that are considered as multidimensionally poor. This is just a comparison. And we see that with the exception of a few programs, such as well, the now suspended Social Welfare Fund in Yemen or the Zakat Fund in Sudan, very few programs are large enough to cover even half of the population, of the child population that is estimated to live in multidimensional poverty. So the main takeaway message here is that cash transfer programs in the region still remain very small. And I'll now hand over to my colleague. She will present a bit more on the legal frameworks of the existing cash transfer programs.
Okay, thank you, Charlotte. I'll take over from here. Discussing a bit more on the legal frameworks, which is the topic of our second study. So using the basis of the programs mapped in the first inventory. And so I'd like to start posing the question, so why legal frameworks are so important? We had some sections yesterday discussing the relevance of a human rights-based approach to social protection. So what this actually means. So first of all, having a legal framework for social protection programs actually enhance the program as a right. So not only as a benefit and shifting away for this charity-based approach that most of the time the social protection programs can have. So second, a legal framework can also help to make the program less prone to political change and changes in government priorities. Finally, they also can help to secure some sort of funding when the legal framework has a prediction and foresees that. So then we come into the 5 criteria that comprehends what we call the human rights-based approach to social protection. So what legal frameworks should exactly have and what the literature and evidence shows that actually can make a difference when having a law for a program. So a law should set out the precise eligibility requirements, so the criteria, if it's target, for example. It should also set out the different roles of institutions involved, so enhancing coordination, bringing more transparency. It could also foresee the long-term financial resources for the programs, and we found some good examples in the region in this regard. It should also establish the accessible complaints mechanisms and appeals mechanisms, so people that might be excluded could also go for some sort of office, or they can claim for the rights if they are denied the benefits. And finally, create participation channels, so including beneficiaries in not only information, communication on the program, but also on enhancing the program itself. So how do I use it? The right. I know. Okay, yes. So on our next slide, you see that in the region there are 74 cash transfers as presented. More than 2/3 actually present some sort of legal framework. It's here important to tell that our definition for legal frameworks actually comprehends both national laws and also secondary law. It's a pretty more comprehensive understanding of legal frameworks when compared to other organizations, including the ILO, for example. It's also important to say that this is actually a high proportion when considering other program types such as health insurances or school feeding programs. You also see that some important programs in the region, the legal framework is actually not existent or in process of deliberation. That's the case, for example, in Morocco. Yesterday I had a chance to talk with some colleagues from Morocco here, and I know that so there are the process for including a legal framework on Taysir, one of the main cash transfers for children in the region. Which actually shows that it's not exactly bad that the program does not have a legal framework. So in most cases, actually, that might be the case that a pilot program was introduced, and just after a legal framework law came up to embed the program, you know, in the law framework of the country. This is the case, for example, in Iraq, and I think that my colleague here will tell more about this. So on the graph, what you can see is that we applied the criteria, the 5 criteria. We did an assessment considering a subselection of programs. We've tried to take the 5 flagship cash transfers, especially targeted at families, vulnerable families or families with children. There were 18 in total. Some countries we did not include. For example, in Palestine, also the main cash transfer program still does not have a legal framework. So we see that in total there are some areas that are quite well covered, although in different extents as well. So in setting the eligibility requirements and also the roles and definitions of which are the institutions involved. These areas are quite well covered, but when considered other aspects, especially on the financing resources and also on the participation channels for citizens, we see that there's still a lot of way to work and room for improvement in considering the social protection laws. So on the next. Moving forward to the conclusion and the findings, we see that most cash transfers in the region, they still target individuals who are unable to work. So we saw that the categorical and means tested are the main often ways of targeting youth. So this sadly can exclude families, working families with children, and that's one of the reasons why we still have a lot of work to do in terms of child sensitivity of programs. So not necessarily children are the main targeted group for cash transfers. We also see that, as my colleague presented, programs are rather small in size. You're not even discussing the adequacy of benefits here, but you see that most programs, they are not large enough to cover not even our vulnerable children in the region, so that's a long way towards improving and expanding access. And when you look at the child vulnerability levels, as our colleague from Tunisia just presented, actually in some countries it makes a very concrete argument for the introduction of universal child allowances. We see also that on the legal frameworks, not necessarily having legal frameworks is enough for the implementation of programs. We have in the region some examples, the Social Welfare Fund in Yemen, which has a pretty much comprehensive legal framework, but the program has been disrupted due to the conflict in 2015. So it's just and also the case for Libya, in which we have by law a cash allowance for children that should be universal, but yet not much evidence on its implementation. So going through the last, you see the relevance of discussing universal child grants, as just pointed out. You see also an opportunity for the region, especially regarding the context of subsidy reforms, creates a great opportunity for enhancing social protection, for reallocating resources towards child benefits, and a good opportunity as well to discuss how these child benefits can also kind of consolidate the social political stability, considering that the removal of subsidies can also be some sort of problematic for the stability of the country, as we have seen in many different examples, Sudan just recently, for example. So you see that there is evidence, but we hope that we keep working on evidence that universal grants for children are actually affordable, equitable, but they should not come alone, of course. They should come with progressive tax systems and quality services, as we have been discussing during this conference as well. So a final remark, I'd like just to show that we have on socialprotection.org our programs that we have mapped, and also the legal frameworks. Then you can find the programs we have for the MENA region, also South Asia, also Africa. We have been actually complementing this database, and very soon more programs will be included. And interestingly, you have also the way to filter the programs, so you can set filters through for cash transfer, conditional, unconditional. Very soon we also have the filter for population groups, so you can actually see which are the programs targeting children. So thank you very much. We are open for questions at the end.
Thank you. Thank you for the interesting study and interesting presentation. If there are clarification questions, it's the time to pose it now. If not, we will move to the next presenter. Atif Khurshid is going to share us his wisdom about what we can expect in this area in Iraq.
Thank you so much. I don't have a presentation, and I will try to tell a story of Iraq through some data and bringing poverty, social protection, public financing together with some proposals, which is based on my own experience, that I was chief of social policy in Iraq for a year and a half. During that time, we released the child poverty report. I worked very closely with government, with Ministry of Labor and Social Affairs. So I had an opportunity to really work very closely with the Iraqi government and look at their system. So from that perspective, I will give my own perspective on what can be done from the universal child grant in Iraq. Just to give you, as you know, the history of Iraq, it's gone through many cycles. The first Gulf War, after that, the sanctions on Iraq, both exporting oil and limited amount of commodities were allowed to enter into Iraq, which resulted into actually the first and probably the largest public food distribution system in Iraq, which is called PDS. It's till now, it's universal. It covers almost 90 to 95% of population, with the exception of ISIL and some conflict areas where there were disruptions in 2014 and 15. It provides 50 to 60% of calorie intake, between 60 to 90% of calorie intake, depending on where you fall into the income distribution. Then the second Iraq war, which resulted into, of course, a long international intervention, and then the political government. And after that, there was a law passed in 2014, with strong technical support from World Bank. As my colleague mentioned, that Iraq is probably the exception in the region where the social protection is framed into the legal law and legal framework. And the law is very progressive. It calls for social protection for all who are residing in Iraq, which is kind of a unique in the region, because it could include anyone who is living there, including refugees, and it could be interpreted in that way. Iraq also has a story of poverty with the transition from international intervention to a democratic government in 2007, 2008, 2005, 6, 7 onwards. The first actually, the data that we looked at was 2007 income and household expenditure survey. And according to that, the poverty rates in Iraq, it's the monetary and income poverty rates in Iraq were around 23%. by 2012 with a very good GDP growth rate driven by oil sector. The poverty was reduced by 4% to 18.9, 19% by 2012. So there was a poverty reduction, but unfortunately in 2014, the drop in massive oil prices as well as the war with ISIL did a big economic contraction. A lot of areas were severely hit by humanitarian situations, so it resulted into impact on households and how they live and how they consume. World Bank estimated through their SWIFT survey in 2014 rough estimates of poverty, and it went up to 23% in 2014 in just 2 years. Slightly different scenario in multidimensional child poverty. As my colleague actually showed in one of the slides, it's around 37 to 39% children were poor in Iraq in 2012. And that's at least in 2 deprivations of child outcomes that they were, and that's how we measure. If you look at child deprivations, you can see particularly some interesting things on stunting, out of school children, even though primary is not a big issue in Iraq, but secondary you will see a big drop, particularly for girls. Water and sanitation also has some issues in terms of coverage, especially in the rural areas. In terms of stunting, you can see the overall stunting rate is around 21, 22%. Poor are around 27%. Rich are around 17, 18%. So there's not a big difference between rich and poor in terms of the stunting in Iraq. As a result of this, of course, the bank, UNICEF, a lot of international partners, they try to work with government of Iraq to really look at what kind of social protection systems can be developed, building on the legacy of both public distribution system, and by 2007, Iraq already had a categorical cash transfer program, which was targeting children, the female-headed households, unemployed, and different disability, different categories. And there was, of course, a lot of exclusion errors. Only 11% of the extreme poor were covered in that categorical targeted cash transfer program. So there was a need for reforming the social cash transfer program. With the technical support from the bank, they shift from categorical in 2013-15 to a PMT-based targeted cash transfer program, which is the SPN, Social Protection Network in Iraq. Which now has around 1 million households. You're looking at around 6 million individuals. And ideally, those 6 million should be poor because there's poverty targeted, but we haven't done an assessment of looking at either what is the exclusion and inclusion errors in that program. So public distribution in terms of the social protection programs, one large public distribution program, food distribution system in Iraq, coverage around 90 to 95%. Then you have a poverty-targeted PMT-based cash transfer program covering around 70 to 80% of poor people. And 1 million households. And then you have an emergency humanitarian, which is under the Ministry of Migration and Displacement, cash transfers for households who are affected by war with ISIL. So three big programs, and there are smaller programs focusing on martyrs and some people who have been affected from terrorism, and some who were sanctioned in previous Saddam government. So government is giving them very generous social pensions and other forms of financial support. Now, if you look at the interesting thing in Iraq is that if you put all these 3 programs together, it is spending around 3.5 to 4% of GDP on social assistance program, if you put PDS, cash transfer, and the emergency, which is a large pocket of money in budget. You're looking around 5.56 billion US dollars, around $5.5 billion. The question for Iraq is what kind of reforms and what should happen with that resources. And we actually, based on the previous data, 2012 data, did some simulations, which is part of the UNICEF report. But since then, the program has shifted, so I haven't included that analysis because it's redundant now. But essentially, there were 2 or 3 scenarios that we looked at, that if you reform the public distribution system and increase the cash transfer program, what will happen on poverty and what will happen and how much money the government will save. So I will share some of the findings, but from that, but then I think I will propose another way forward for Iraq, which would be possible and a very interesting option. The first scenario that we looked at is that you completely seize PDS, because the public distribution system, and government is around spending 3.4 trillion Iraqi dinars, which are around 2.7 billion US dollars on public distribution system. There's a lot of inefficiencies, the program implementation, high cost, mismanagement, all kinds of issues are in that public distribution system. But one thing that we need to be mindful is that public distribution system provides around, as I mentioned, 60 to 90% of calorie intake for the household. So you cannot really remove it because it's going to have an impact on the middle income or households. So that needs to be very smartly done. So the first scenario is, of course, we said, okay, let's look at the scenario where you are completely removing the PDS and doing the cash transfer. So the scenario with that, of course, you're increasing the poverty. Extreme poverty will increase because you're removing a very basic consumption from the households. The second scenario is that you target the PDS in rural areas where the poverty rates are high. In that case also, you are relatively small, but again increasing the poverty, and you are also slightly increasing the food poverty because there is an urban poverty pockets in Iraq as well. The third scenario was PDS is only districts with poverty rates of 25 plus. In that scenario as well, the effects were not, the poverty rates was increased less than the second scenario, and the extreme poverty was also slightly increased than the baseline of 2012. The fourth and fifth scenario was very interesting, where we said, okay, let's do a targeted cash transfer program, which Iraq is doing now, which is happening now. Let's do a targeted cash transfer with exclusion error of 40, what will happen? And in that case, you are reducing poverty by only 0.3%, 0.03%, and extreme poverty is also reducing, and you are saving some money from the PDS pocket. The fifth scenario is you do reduce the exclusion error to 30% from 40%. What will happen? And in that case, poverty jumps around 2%, and then your extreme poverty is also almost halved, and then you are reducing around 15 to 20% on the PDS budget as well. So that's a likely scenario that could be happen. Now, since Iraq already is expanding the cash transfer program, the SPN is being rolled out, and it's targeting almost 1 million households, with almost 2 million households already in the social registry, and they're expanding the social registry system in Iraq. The other scenario could be, actually government can now from here onwards can go to some kind of a universal approach in Iraq, because they have resources. The PDS is still intact in Iraq, and there are ways that it can be reformed, and the money saved can be invested in different forms. The current budget of cash transfer is around 1.8 billion, and you have around 2.8 billion from PDS spending that could be either progressively used by improving the targeted of the current cash transfer program, and slowly and gradually you can add either a child grant into it, you can add social pension into it, you can add different pieces into it, and of course there's a more rigorous simulations and scenario building that could be done through the technical assistance from the bank or UNICEF, and all of us can come together. With that, I think just maybe a few last words on Iraq, that I personally found that the government itself is very willing. They are open for ideas, and they really want to move on better targeted systems, better the improvements in cash transfers, in terms of targeting, in terms of efficiency, in terms of effectiveness. And there is an opportunity for us to work in Iraq and really come up with different scenarios or modeling of how to reform the public distribution system, and how the money saved from there can be then invested in either a form of UCG, either a form of social pension, whatever the needs are, that can be the money can be easily found. Thank you.
Thank you very much for a fascinating presentation. So now the floor is open for your questions, comments, observations. Please feel free to speak to the microphone. If at this moment there are no questions, let me start by posing some questions. So I'm going to formulate a question to, there is a, okay. Yes, Amadeus, please.
Thank you so much. Certainly, the presentations have really been very informative. For Charlotte and Caroline, my interest was on the legal framework, where you have indicated that about 2/3, if I heard you correctly, have legal framework. Now, I just wanted to know whether you explored further to find out those that doesn't have legal framework, what was the reason? I mean, if you explored further, given the advantages of having legal frameworks. But for Atif, there is a moment, I think it was 2015, when a decision was made to move from categorical to the other modality of targeting. I didn't follow closely what was the reason in 2015. But for the first presentation in Tunisia, where you were comparing contributory and non-contributory, you indicated that the number of those covered under non-contributory was not as big as under contributory. Whether there is some reason why this big difference? Thank you.
Thank you for the question. So considering why those programs still do not have a legal framework, if I understood correctly. So what it could see is that, many programs, they start in a very small scale, sometimes a pilot, and that's one of the reasons why I could see that programs might not have a legal framework from the very beginning. The second point that I would highlight is that sometimes the negotiations and the coordination necessary for establishing a legal framework is so time-consuming and depends a lot on the institutional coordination in the country that it's not uncommon that a ministry, for example, can just go forward, establish a small program with an internal regulation, or sometimes not even with a regulation, just as a pilot. And then when the program is much bigger, it's going to be transformed into a national implemented with a legal framework. this is not only a characteristic for the MENA region, this also happens in other regions. In Brazil, where I'm come from, Bolsa Família itself started, and till nowadays we don't have a national law from, like, for example, as enshrined in the Constitution to establish the program. It's a regulation, and as I said, like now in our study, we consider a more comprehensive definition for legal framework. So then Bolsa Família, for example, would be included as having a legal framework, but we understand that once the program has a law passed by Parliament, for example, it makes it much more stable than just as another type of regulation.
Good question, actually. In 2014, the law was changed. I don't specifically, I was not there, so I don't know the arguments made for change in law, but the data that I have seen, there were big, it was categorical, but if you look at it from the equity point of view, it was, there were a large number of poor who were missing or not benefiting from the cash transfer program. As I mentioned, I have to pull up the data, and I can give you some numbers on the extreme poor. Roughly, I think around 11% extreme poor. I can double check and give you were benefiting from the cash categorical transfer versus 89% missing out completely from that. And if you look at just poor, not the extreme poor, but the national poverty line, people below that, there were also exclusion errors and inclusion errors. It was high exclusion and inclusion errors. So, you know, it's funny that you ask this question, because sometimes, and that's kind of how these national dialogues happen has an impact or implication for what kind of programs we design. Because if at the national level you care about poverty and you want to address it, and that becomes your part of your national agenda, then of course you're going to try to find where the poor are, and then you go for the PMT and you go for other targeting mechanisms to find and target. But if the national dialogue, it's about rights, and every individual should have the right, every person should have the right to social protection, then it becomes, okay, what kind of mechanisms that we make sure that everyone should have these benefits, and then you probably are leaning more towards universal targeted programs.
Thank you very much for your question. As I was giving you these details, I was trying to describe that the way the current cash transfer system is set up, it's a bit fragmented. So right now, the social security system in Tunisia is rather robust. It covers 87% of the current active working population. That's why family benefits in the contributory sector are much larger than those in the non-contributory sector. Nevertheless, looking at the non-contributory sector, we have a low number of beneficiaries, and the reason is because it's a sub-program. So we have a larger program. This is the national program providing assistance to needy families and households. So there's 10 dinars cash transfer for these households. And this is usually people who are unable to work, older people, people without many children. That explains why these figures are so low for the non-contributory program. So these are the data. We see children in the informal sector. And so we'd like to expand this program to other categories like those working in the informal economy so we can reach more children. There's also the 0 to 5 year bracket. These people are not benefiting from this program. And there's also the 3-child cap. That explains these figures, 2% for the non-contributory sector and approximately 30% for the contributory sector. Thank you very much.
Yes, please. I see a question, please.
I'm Buthaina from the MENA Regional Office with UNICEF. I just have a comment on, on the challenges, and thank you very much for the excellent presentations. Given that the MENA region has many countries that are either conflict affected or civil unrest affected, trying to really make policy reform vis-a-vis social protection is very sensitive and it's very complex. And that's why, referring to the discussions of yesterday, whatever we plan to do have to be context specific. And, just mentioning, for example, the reform of the public distribution system in Iraq, and, the clear evidence, it has to be reformed. We all agree. And then in practice, given the situation of the country, given that the current system of the public distribution system, already there are powers in place, and whatever reform might really create, challenges vis-a-vis social cohesion or others. The same, for example, for other countries in the region. So my question to actually all of you is, with that context, how do you see, and with a future-looking vision for the region, how do we do such reforms, given that the context is very complex? Thank you.
That's a really complicated question, but yeah, let's do reflections on that, and I can add to it a little bit. I noticed all three presentations mentioned subsidy. Subsidies, in fact, is a legacy of the previous social contract. Some element of this social contract are already gone. For example, the role of the public sector as the major uplifting force for the social mobility, large state-owned enterprise sector that was creating good jobs in the economies. All of this is gone. The subsidy is one of these last elements that remain there. And yet I haven't seen the country, with exception of Iran, that was discussed here several times already, that actually managed to remove at least part of the subsidy, replacing it with some form of a universal cash transfers that, according to all estimates, all of the policy debate, is improving the distribution in a most progressive way. The middle class, the poor, are gaining from such reforms, and yet they are probably the first ones that the policymakers are concerned. And there is a lot of apprehension for this change. So since it's hard to say what to do unless you actually diagnose the problem, what do you think are the major obstacles for having such a clear policy proposal, moving from something old, obsolete, inefficient, unjust, unequal, to a clear gain? What do you think are the reasons why there is so much concern with Putin implementing that in practice? So that's, I'm really curious what you think. Maybe we can start with Maha this time and hear from her, and then move to other colleagues at the table.
En fait, bon, la question...
Yes. Subsidies. A few years ago, this was a taboo. We didn't talk about subsidies, especially for food products in Tunisia. We recall the 1980s, when there was an effort to lift subsidies for bread, and there were riots. So I think that we've moved beyond that. The file is currently on the table, and everyone's aware that subsidies, especially food and energy subsidies, are not reaching beneficiary populations. Studies have demonstrated this, that really these subsidies go to the richer, and they go to those individuals outside households. They go to tourism, for example, and so it's not really reaching Tunisian households when it comes to food subsidies. There are some fears, of course, but there are working groups addressing this. This is also the case of a study which is currently underway with the World Bank, considering lifting subsidies for energy products. We're also reflecting on this in the Ministry of Trade, and the government is actively involved in this. We're considering the various scenarios. If we were to lift food subsidies, how could we replace them through cash transfers to households? Who would benefit from this? Would this be universal? Would this be targeted? We're considering all of these questions. Various calculations have been made, and I do think that this is a step forward. People are even discussing this in the streets. This is clear progress. So in the past, discussion of lifting food subsidies would give rise to fears, but I think moving forwards, we will address this. As I said this in my presentation, there are various reforms underway, and sometimes you end up losing out a little bit. So you really need to have your priorities straight. You can't tackle everything at the same time. You really need to take a global look, consider your priorities, and see how there might be synergies. So that's what we're doing. Thank you.
Okay, well, thank you for those inputs. I'd like to reflect maybe first on Butaina's comment on, of course, the prevalence of conflict in the region. I think, yeah, this has maybe in this conference so far not figured that much yet, because of course it's a global conference. But I think it's, of course, it's very important to take into consideration for the MENA region, and it makes discussing the MENA region also different from other regions in the world. And I think the role maybe of, I mean, this conference is organized by UNICEF, but of course UNICEF and other agencies in the MENA region are quite active in terms of humanitarian programs in countries that are suffering from conflict. They think this is, and they have been playing quite an important role in terms of implementing also cash transfer programs in the region. And I think this is something, a topic that we, especially for the MENA region, should discuss more in this conference. So this nexus and the linkages between humanitarian programs and government-provided programs and potential, well, handovers to governments from humanitarian agencies, or potential handovers after conflict. And well, the second point raised by Ruslan and also addressed now by our colleagues from Tunisia, I think many of us were probably quite hopeful, like over the past years, that the changes that we're still witnessing in the MENA region, they would provide space for more profound social protection reforms or social policy reforms in a wider sense. Unfortunately, this has not always happened, or not to the extent, at least, that we maybe hope for. Yeah, I think the social, in terms of social protection reforms, it still remains, well, quite limited, and it's not really a transformative change that we can see. And yeah, the process does not really seem to have been very well inclusive in terms of really building a new social contract. And I think now also adding on the discussions that were already ongoing in terms of subsidy removals, I'd also like to take the opportunity to ask Atif maybe, because you presented the scenarios for potential removal or reduction of the PDS, and how feasible you think this is in terms of political and social, politically and socially. So in terms of unrest and acceptance by different political or different classes in Iraq. Thank you.
Thank you. Butena, that's a very, very interesting question. I will look at I will start with Iraq's example. There is, it goes back to your point about the social contract. It's a lot of countries, there's a history of more authoritative governments, right? So, and it's about legitimacy, it's about, keeping a population at a certain level of understanding, roles and responsibilities between the citizens and states. There were free handouts given to people to keep them quiet, keep them, but at the same time catering for all their needs so that they feel okay as the things are the way moving and I think, and paradoxically, I think there's a space where universalism fits very well in this region, right? Because people are welcoming those ideas that everyone should have a lot of these benefits. So if you look at the Iraq's context, I think that gives a very interesting opportunity to reform PDS into some kind of a child allowance, old pension allowance, and you can actually, the amount saved there is quite large. It's almost $2.7, $2.8 billion, which comes to around 1.5, 1.6% of the GDP, and that's a large amount. And if you look at some of the ILO's financing universal social protection or cash transfers, it's around 2% of the GDP. So you're very close of universalism if we move that into some kind of a universal cash entitlements to everyone. And with that, I know that there's more efficiency. The cash can be effective in multiple ways. There is also a benefit to the local economy, the trickle down, the multiplier effects. The shops, the businesses open. Consumption improves, dietary diversity improves, educational and other indicators also improve because of this. But if you look at the subsidy, the food particular angle of here, then you are looking at a lot of, the countries in the MENA region, the agricultural productivity is not high, we know that, right? So there's a lot of issues about agriculture, productivity, distribution, and bringing. So a lot of countries are importing, they're net importers in agriculture. So even if you have these large food distribution mechanisms, you are the cost is high, and then you have a distribution, then you have a lot of other mechanisms. So with that, you're also saving a lot of, so that's one point on how to go about it in this very difficult environment. But we understand that if, particularly a country like Yemen, country like Syria, which is an active conflict area, then the issues are completely different. There's a more humanitarian situation. But even in those circumstances, as an international partners, as we know, and Butena, as you know, actually better than anyone else, is we try to link up with the systems, we try to push these more sustainable thinking as much as we can as we implement a lot of these programs in those countries. Coming to Ruslan, your question, I think that's still a lingering issue in MENA region, the subsidies. I think the fuel subsidy or energy subsidy, as my colleague mentioned, has been, I know that there was conversation in Egypt, and I don't know how far they have gone in terms of removing that. The dip in oil prices, I was reading some news and papers that was probably a very good opportunity for Egypt to remove, because the oil prices were low and they can easily do it at that time, and I don't know if that happened or not. And in Iraq, IMF has a standby agreement, and I think it runs till 2019. Or I think probably 2018 was the year. And as part of that, they're looking at electricity subsidy, energy subsidy, and try to see how they can reform that. And even the electricity subsidy, in terms of the fiscal space in Iraq, I just want to spend a few minutes in the Iraqi context. They have a very large electricity subsidy, on top of the 3.5% that I mentioned on the social transfers. They have a very generous pension to the government employees. Public spending is around 40% of the GDP, which is probably at par with the high-income countries, if you look at the total public spending. And then it has very low indirect taxation. There is no, they just introduced tobacco tax. There's no legal framework around taxation. It's more, every year in the budget, they introduce some new taxes, they remove some taxes, so it's kind of an ad hoc tax, indirect taxation policy. They introduce some airfare taxation, some tobacco tax, and some taxation on cars. And they also removed some high net earners from some public distribution system as well. So in a way, a lot of these countries, particularly if they are, the oil exporting economies like Iraq, there is a lot of space. There is a lot of things that can be looked at in different scenarios, and I think there can be built very progressive, strong taxation policy with the transfers policy, the social protection systems that can be really sustainable and be effective in addressing a lot of the issues from the child perspective, the multidimensional perspective. And so there's a lot of issues of effectiveness, efficiency, vision in the context of Iraq. Thank you.
Thank you, Atif. I think we are close to conclude this panel, and I observed that there is really a consensus here in terms of what specificity the region represents, how important are those issues, and the subsidy reform really works as almost like a litmus paper, trying to see us what the societal preferences are and what are the risks and challenges. So one important thing that all commentators noticed, yes, there is an economic logic behind these reforms, but we also noted two other important context factors: ongoing conflicts, societal tensions, perceptions of injustice and inequality. That means that people really are striving, are very hungry, very demanding the entitlements, the predictability. Precisely those factors may make public very reluctant to welcome the choices because there is a risk of exclusion. The statistics that was presented by our colleagues from the Center of Inclusive Growth shows very high exclusion in the existing programs. And we heard from Maha how large the exclusion is in the current well-developed by regional standard systems that is based on legal entitlements. And so this risk of exclusion makes our focus on inclusion, which is a focus of this conference and which is a focus of this panel as well, as really practical way to address this specific issue, specific reform towards greater progressivity and modern social contract. There should be no tolerance for exclusion. That is one thing we should kind of take away from the debates that we're having here. And importance of legal framework. I noticed that, for example, yes, you put a very nice definitions for the legal framework and what elements it entails, the 5 different elements it entails. And in general, yes, something is enshrined in law, but you also put examples when the law exists and there is nothing in place, right? There is no evidence that this is being implemented. That is a huge risk. If you proclaim certain entitlements and then you cannot really deliver, it's becoming itself a risk factor. So we really need to make sure that those legal rights, and it's a right approach in this environment to build legal rights. That's why the approach that Tunisia is taking of very gradual, careful expansion of the current entitlements to the new populations that are currently excluded is, I believe, is a model that we just have to take in and think about it, how how it's important and how it creates this a lot of safeguards in this process. Not big jumps, gradual, right-based approach, but the rights that are really can be enforced and not simply proclaimed. So I believe we concluded on a very good, productive way. And if you have any more comments, questions, we still have 4 minutes to go. Otherwise, we'll just put it close. Any comments, questions? Okay, I see a lot of people now reacting. Okay, please go ahead.
Thank you so much. I found your discussion on right-based approach to social protection very interesting. No question that social protection, especially when it comes to children, is part of international human rights framework. But something which is not far from controversy for me is that how to impose immediate legal obligations upon a state to provide social protection when there is not enough and sufficient finance for that. We know that social protection is part of economic, social, and cultural rights to which states are obliged to achieve progressively. We have the idea of progressive realization in the light of the available resources and infrastructure. Because when we say that there is a legal right for individual to demand, then the next step is the justiciability of these proclaimed rights. And the problem and concern that we have in the region is that if we want to legalize the question of social protection, how we can manage responding to these legal demands when financing aspect is not well secured. Thank you.
Yep, very relevant question. And yes, I think I would just add on this, referring that the way as we see and the way as all the studies on international human rights and the relevance of legal frameworks are set, usually defines it as an important start point. I don't really, as I just mentioned here, we do recognize that having the single fact that we have a legal framework does not actually makes it automatic that the program will be implemented, that the right to be actually enforced. So, but I do see that having a legal framework first can create this entitlement and can even help stakeholders to kind of organize themselves in this regard. So I think Atif can maybe complement better on the case of Iraq, but in terms of financial resources, the law in itself creates a fund. And of course, creating the fund is also not necessarily not enough for actually directing the funds, but that the law in it can foresee the percentages of each area that could be charged and could bring resources for the programs that are being implemented, including, for example, I think that includes something, even tourism, but it has some sort of variety of resources. So, in my opinion, we should all see that as a relevant start point, and of course, not enough, but as important to work together and implement these rights.
I just wanted to say that it is true that the more right approach is something that we have to put into place, but there are, of course, financial limitations. But what we need to do, the most important thing is to just begin, just start, because even if we start with small and slow steps, we can still arrive at our final objective. So what we need to do is we at least need to start work.
Yes, I think just complementing what my colleagues have already mentioned, it's, you have to look at social protection and financing together, particularly when you are looking at universal coverage, and particularly the taxation, the progressive taxation. And I think there is always room, there is always space, and it comes back, for me, it comes back to the social contract piece. That what kind of societies do we want? What kind of a group of individuals living in those boundaries in that state? What is our relationship with each other, and what is our relationship with the state, the group of people that we voted to be our representatives? So if we agree collectively and define that we want everyone to be productive, the resources, we will find it. It's the better management of resources. It's about the growth. It's about, progressively as a nation, as a country, working towards those goals. But I agree that they go hand in hand, and we have to, and as actually in the beginning of the day, beginning of this conference, it was mentioned that even in the poorest of countries, there are still resources that can be found if there's a political will and if there is a clear vision and strategy and social contract is in place.
Thank you very much. I think I agree with the idea that we have to go ahead, but I think gradually, especially when we want to try to resolve this question of funding by using subsidies reforms. From this morning to this session, I think we have a lot of things to learn about this. Why? Because the question of subsidies reform is not easy to do. We have to take a lot of dimensions, especially social dimension. The situation of Tunisia, as like in Morocco, I think is the same in terms of some roles to take into consideration. This morning, it was easy to say that we have to change the boxes. The box for reforms, for subsidies, to reforms for social protection. It's okay, it's easy to say in a meeting like that, but I think it's very, very, very difficult to apply. We have to be careful about what we have to do in practical things, not in theoretical things. I agree with some simulation to do, with a lot of things, a lot of reflection to do, but I think we have to take into consideration 3 dimensions, social dimension, economic dimensions, and political dimensions. Thank you.
Thank you. Thank you for these words of wisdom. I guess we exhausted our time, and we are still here working on this conference. So if you want to discuss something with the panelists, between different delegations, we always have this opportunity to do it. My big thanks to all of the presenters for really making very succinct, very clear, very logical interventions, speaking without slides, but telling fascinating story. Very clear set of slides from Tunisia, and I'm really congratulating you for the progress you are making, and very interesting study from the center in Brazil. So you are doing a fantastic job, so thank you very much for your efforts.
Thank you.
Thank you.
Thank you, Ruslan.
All right.
That's really well.
Yeah, good.
Okay.
Good.